Doc is back. Welcome to Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join Doc and his guests as they discuss healthcare and the Caribbean community every Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms.
I didn't grow up here, but Broward County has become home to me. This is where I settled. I raised my family here and started my practice here. For over 20 years, I've represented my neighbors, people who needed help in a stressful time. If you find yourself in need of an attorney, reach out to someone you can trust, someone with a proven track record.
When a car accident or personal injury sets you back, call Scott McCullough.
954-989-3435.
Hello, ladies and gentlemen, and welcome to this week's episode of Medically Speaking with Dr. Winston Alexis. Doc.
Yeah, what's up? What's up?
Well, how are you this rainy day
Not
here
bad.
in South Florida?
Trying to decide whether I should vote early or go on the regular day. I ain't mailing nothing. I either voting early or going in. But the important thing is how you vote. And it looks like they're covering all bases with the mail-in votes. They ain't taking it serious. You know, they actually went to the Supreme Court.
Yes.
And the Supreme Court said, listen, stop this foolishness. People will be allowed to vote by mail.
Absolutely.
Right? Yeah, just trying to get myself ready for this. And as a matter of fact, our next program is really going to be interesting. It's going to involve some politics because we're talking about healthcare for the nation.
Yes.
That's a big topic. I'm not sure if we could do it in one try, but we're going to try. And it's not easy to comprehend. So patients women and guys better get ready with pen and pencil.
That's right.
Next week. And it's a good thing they could go back and replay.
And they can listen on demand.
Right. And
on
this,
your own schedule.
Right. All our shows. And this means you can go back. When you get the insurance, somebody say, this is what I want. You could go back and say,
correct.
Where Doc say about copy.
Correct.
Right?
Correct.
But as usual, I've been moving all over the medical map.
Yes.
Now I want to settle back in something I really know.
So
that doesn't mean that.
So hold on. So are you saying that we're going back into our area of expertise?
Exactly. But that doesn't mean to say what I give you in the other area is wrong. I was not an expert. I was good.
All right.
But this is expertise.
All right. So ladies, and gentlemen, what we're really saying is that we are going to speak this episode about the ladies.
Especially.
Yes.
And then the guys could extrapolate a little bit to them, but I ain't studying them guys. But they could draw conclusion from what I'm going to say, because so men can also learn from it.
Indeed.
Right.
Indeed. So the topic that we're going to be discussing is abdominal pain.
The second most common reasons for females all over the world going to gynecologist's office. First one is bleeding.
Which we covered
bleeding.
Which we covered a few episodes ago.
Right, this, as a matter of fact, is some of the more serious symptom. You're bleeding, I have a couple of ideas what's happening to you already. Right? Vaginal bleeding. It coming from the uterus, ain't coming from the westward. Pain now. Mm-hmm. I don't know where the heck this pain is coming from.
So let's kick it off here, Doc. So a patient comes to your office and they get into your examination room and they say to you, Doc, I got pain in the belly.
And they stand up and stare at me.
Yes. What happens next?
I say, well, when I get up this morning, I had some too, you know. But you have to help me. You can't just tell me you have pain in your belly. I have pain in my belly this morning too. So you have to, the point I'm making, you have to give me a little more information.
All right.
And let me tell you what doctoring is. Doctoring is one of the most important parts is questioning the patient.
Yes.
People think it's exam. By the time I examine a patient, I'm telling you, I have a good idea of what I think is wrong. And I must say, every now and then I'm wrong. About 10% of the time, what I think after talking to you, I'm wrong. 90% I'm right.
Oh.
All right, but that's not the general statistics for all the gynecologists as me.
Well, those are good numbers.
Yeah, if some making 50, that's real good. So you can see where I put myself, right?
Well, those are astronomical numbers.
Now you're talking. But the point is,
you're that good.
Yeah, and how good? No, and how good a doctor is how well he can extract essential information from the person.
Right.
And the reasoning is simple. Think your belly big, you know. No, I don't mean that. I don't. I'm not throwing words at you. I should say there's a lot of space in your belly with a lot of different organs.
All right.
Your belly have your bowel. Your belly have your bladder. Your belly have all your female organs. Your belly have a little tube called ureter going up. Your belly have your gallbladder. Your belly have your colon. Your belly have your appendix. You see where I'm going with? Your belly have your liver. Your belly have your spleen. So when you say belly to me, I'm saying and?
What else?
Yeah, you can. All right, so a good doctor now is going to extract a history from you. And this is important to you, public. You should have a general idea of the questions he's going to ask you, so you make note of it at home.
Okay. So
let me give you an example.
So before coming in,
yes,
and you do know that you have this symptom,
exactly,
and take note of the questions.
Right. So the first thing you do, you say, is this sudden pain, acute we call that, or is this a little pain that working itself up since yesterday afternoon, a little bit more, come, go a little bit more. So we divide it into chronic and acute.
Okay.
Acute, you need to be in somebody's emergency room.
Right.
For instance, sudden pain that bring you down to your knees, especially if it's one or the other side of the belly. I don't even need to know what it is. It needs to go to the hospital.
Okay.
However, you don't have to rush, but learn two things about acute, sudden, life-threatening pain. It never gets better.
Okay.
It gets only worse. So if you have a pain that coming, boy, and you give a break for about 30 minutes and you come back again, that is not likely to be acute.
Okay.
It stab you in your belly and oh God, half hour later it worse. And they have some other symptoms, but the first thing, how bad is it initially? And is it either staying pat or getting worse? If it's getting worse within the first hour, go to the hospital. If it come in and go, then you could wait till tomorrow morning, drink some ginger tea and come see me in the morning. Right. Or as they say in the old days, take 2 Panadol and come in the morning. Right?
No, Doc. Is this the same for females who are pregnant versus those who are not?
Yeah, but pregnant women, they ain't waiting half an hour. They're waiting like 10 minutes.
Okay.
And if that pain, either they or you go to the labor floor.
Right, okay.
So good question.
Yes.
We separating pregnant women. Any little pain they have that last infant, go. I'm talking about new pain and serious pain, go to the hospital.
Okay.
Very good point. I'm talking about gynecologic.
Okay, got it.
All right?
Got it.
The most common serious things with gynecologic sudden pain is rupture of a ovarian cyst, right? Or twisting of your bowel.
Okay.
Or appendix rupture. So all of those, you go in, boom. Those are the ones that will not improve. Come and go. It less 1 hour ago than it was at. Bad pain get worse.
Got it.
Does not go back and forth. Okay. So that's the first thing. You separate it. Oh, there's a little pain. It come. Then I could sit down, watch half of the TV show. Oh God, it come back again. Those are pain in which you're going to come see your gynecologist in the morning.
Yeah.
But this is the information you need to find out. Number one, what kind of pain? Is it crampy? Or is it a pain that just come and stay there for a while? Or is it griping? Let go. Let go. So the type of pain, dull, crampy, right? Those are the two most common ones.
All right. So, tell me now, Doc. So again, if you can just go back 1 second and tell me, You had given us a few examples of what could cause those.
Yes.
Remind me again.
Appendix.
Okay.
Ruptured ovarian cyst. Ectopic pregnancy, one of the most dangerous things in female. Okay. By the way, the guys have everything so far except the ruptured ovarian cyst and the ectopic. Because if you go for that, we're going to look at you kind of funny when it comes. But the guys, again, it could be a ruptured appendix. That man or woman.
Man or woman.
You understand? It could be a twisted bowel. Man or woman.
Okay.
Right? The only one that is purely woman would be more ovarian cyst twisting or burst, ectopic pregnancy or pregnancy in the tube. You understand? Or other things like fibroids. And you'll be surprised at some of the things I'm going to talk about that can cause pain in the belly, and it has nothing to do with anything in the belly.
Okay.
That's the nice part. So remember, the first thing is this pain dull? Or it coming and going? Because I'm going to ask you that when you sit down, pain? Oh yeah, where's the pain? Okay, it's here. Does it come and go, or is it a steady dull pain? Right, so there's two things. I have some more to give you on how I questioned my patients, okay?
All right. Doc, we're going to take a short break, and we'll be right back.
Dr. Ronald Moore and his team at Minimally Invasive Surgery perform laparoscopic robotic procedures with the utmost precision. As a bariatric surgery specialist, Dr. Moore performs a range of surgeries and operations focusing on areas and organs of the abdomen. For gastric sleeve, bypass, and banding, to endoscopic balloon and hernia procedures, call the Office of Minimally Invasive Surgery at 954-797-4220 to schedule your appointment. Minimally Invasive Surgery has 2 convenient Broward County locations to serve you. Call 954-797-4220 to schedule your appointment today.
And we're back to Medically Speaking with Dr. Winston Alexis. Our topic this evening is abdominal pain in women. So far we've discussed the pain, whether it is acute, meaning sudden, or chronic, if it is a long-running, coming and going type of pain. Then we're talking about the type of pain, and these are some of the questions that your doctor should or your physician should be asking. Is it a dull pain or a crampy pain? So, Doc, tell us some of the questions that the patient should be prepared to answer.
All right. Does the pain go anywhere? Meaning, we in medicine have something called radiation, where it's not the same thing that comes from the sun and x-rays. This means, does the pain go anywhere? It start on your right side. Suppose it travel up to your upper stomach. That's radiation. Does it go down to your leg? That's radiation. You understand? In other words, does it move anywhere is important.
Okay.
All right? And later on, I'll give you reasons for why all these questions.
All right.
So radiation is someone. Does it go anywhere else? Next one. Does it get worse with any activity? Does it get worse with sex? Does it get worse with moving around? Does it get worse when you lay on your left or your right side? Right? Right? The third thing, are there any associated symptoms? Do you feel like vomiting? You understand? Do you break out in sweats when it happens? Do you feel weak and faint? So you should be able, don't tell me I have belly pain. When I start, you as a matter of fact, you should tell me, Doc, I have this pain and it moving to my back. If I lay down on my left side, I feel it more. If I don't lay down on my right side, I don't feel it as much. If I have sex, it hurt. And then the things that make it get better. Maybe I belch and it get better. Maybe I pass gas and it get better.
Okay.
So there are many things about pain. You just can't come and say I have pain. And you'll be surprised how I use just the history. Just from some of the things I tell you. That I have a little idea what the hell this thing might be. And by the way, I leave out one good thing. Does it come with your period?
Yeah.
Does it get worse with your period? So the point is, pain is just not a plain single symptom. Right? And believe it or not, we could make a roadmap from everything I ask you there.
Explain.
All right. For instance, if you come and tell me, God, there's a sudden pain in my right lower abdomen. And Doc, it coming and going. And when it comes sometime, Jesus, I feel like I want to vomit, or sometimes I do vomit, right? And it's on my left side. That is exactly how ruptured ovarian cysts behave, or twisted ovarian cysts. By the way, many people go to the ER and that's the diagnosis made in the hospital. And half of the time the diagnosis is foolishness. Because when I question the patient, the doctor said there must burst a cyst. Burst what cyst? Because he going by one, it's sudden pain.
Okay.
But usually when you burst cyst or you twist, you get sick, you don't get better. Right? If it's a temporary thing, it ain't a ruptured cyst. Ruptured cysts get bad. And then, by the first and second day, it goes slowly less and less and less. Right? So again, by me hearing what you have to say, in other words, if a patient's under a different scenario, doc, I have this pain down on my right side. Jesus Christ. Does it come and go? No, it's mostly a pain. It might ease a little bit, but it's coming. When last you had something to eat, oh God, I didn't feel like eating nothing. I lose my appetite. When last you move your bowel, oh God, doc, I ain't move it for about 2 days. You have appendicitis. You see, just from those simple things, you tell me you eat when you have it, and you have moved your bowel in more than 24 hours. That's classic for appendicitis and pain on the right side.
And what follows that initial thought?
Right.
Or diagnosis?
All right. Even though we're going to go through a couple of more, you're now into stage 2. Now I'm going to do laboratory and imaging that help make my case or break my case.
Okay. All right. So hold that thought.
And people must understand, that's a very important thing. Ultrasound, X-ray, lab work, never make a diagnosis for me. They either support what I think or they don't. If they don't support, I say, hell boy, you better look for something else, I don't look at the ultrasound for diagnosis. People think so. Oh, do an ultrasound now, doc. I say, well, doctors, ultrasound? Well, tell me. Ultrasound and labs are only to support or go against what the doctor feels is the problem. You don't do the labs to find an answer. And a lot of people think that's what MRI. Oh, I want a CAT scan. Oh, yeah, and with the CAT scan, go show you. Like CAT scan, just do a CAT scan on everybody. Oh, there is the diagnosis. It does not work like that. The history is more important than the imaging. Then I know which imaging to get.
Okay.
Right,
so another common thread, ladies and gentlemen, if you've listened to any of our previous episodes, is that your family history or your family health history and your health history is very important when it comes to your visits with your physician.
By the way, you are making a point that's really good. You're going into my old talk here, piece by piece. You give me a hard time.
Doc, what can I
All right, so once I get your history that's called history of present illness. Then stage 2, I get a little family history.
Yes.
Anybody in your family here? You understand me?
Mm-hmm.
Then we get to imaging. Imaging way down the road, And I say imaging, labs and imaging. So I'm trying to show people how it is really important for you to pay attention to your symptoms.
Yes.
I want to ask you when last you eat, and you say, God, let me see, maybe 2 weeks. But I had a party down the road. Once you start having symptoms associated with activities that you have during the course of a day.
So you said you had some more examples of the road maps.
Yeah.
Give me one or two more.
Well, I was giving you very general. A couple one, diverticulitis in the bowel.
Mm-hmm.
On the left side, low down, it is exactly where the left ovary is located. But it so happens the left part of your colon is there also. So when you come and tell me your left ovary hurt, you think so. It might be the colon because the left ovary sit on the colon over there. You understand? So when they say, oh, my right ovary hurt, I say, what? Your what? So what medical school you went to? I want to go to that one. That you sit down home and tell me your ovary hurting. What the hell?
So is that something that's typically misdiagnosed?
But yeah, every woman who have pain in the lower belly or my right belly, doc, I think is these
Not
five.
by the woman, doc. I mean by physicians.
Or these fibroids. I say, how you know? Just don't make no diagnosis. Concentrate on giving me adequate symptoms.
Yes.
And I will get to the answer quicker.
Okay.
And you will get better. And same thing, when I go to my urologist, I go to him and he asks me all kind of questions. When last you pee, you getting up at night to pee, can you hold your pee?
Mm-hmm.
That is what he's making his diagnosis. He's not something that pulling it out of glass, them wrong glass ball. It's not magic. So again, know your symptoms. Let me digress a little bit. Even with bleeding, I want to know how much. I want to know, do you have symptoms with the bleeding? Are you passing clots? Right?
Mm-hmm.
Do you feel like fainting when they come out? Right? You tell me I'm bleeding plenty. My question is, you're soaking a pad? What you call plenty? In other words, what people don't know, you take one drop of blood and you throw it in a toilet. It look like the toilet full up with blood because it dilute out. So we don't go by how much pads you use. 5? How much you normally use? 3. Oh, that's bleeding. Are the pads soaked? So I want patients to become better historians. Pay attention to whatever symptom you have. So when I come and ask you, how many times will doc, it hurt at night, but I notice I could still sleep. Oh, doc, it hurt, and when I lay down in bed, it feel better. Or when I lay down, oh God, I can't lay down. I have to come and sit up all night. History, again, is important. I'll get to some specific problems in female that are very common, gynecologic problems. But I want you to know things like appendicitis, diverticulitis. There's one called irritable bowel syndrome that causes bloating and pain in the lower abdomen. And most of those women who I end up making a diagnosis like irritable bowel coming with a pain in the pelvic organs. And they don't realize your colon is in your pelvis. Again, your bladder is in your pelvis. Your ureter is in your pelvis. Piece of your rectum in the pelvis. And don't talk about blood vessels and nerves and lymph nodes. It's loaded. Right? So telling me your pelvic organs hurt. I mean your ovary. It's better you come and tell me your pelvic organs because there are many of them down there. But come in with the diagnosis for me and say, oops, okay. All right, yeah.
All right, Doc. So let's take a quick break. Then we're going to come back and we're going to talk about some more of this.
Right.
For the absolute best obstetrics and gynecology care, call South Florida OBGYN at 954-452-4377. Schedule your appointment today with Dr. Winston Alexis, who has been serving the women of South Florida for over 25 years. Conveniently located in Plantation, Florida, the courteous and professional team at South Florida OBGYN are standing by to assist you. Schedule your appointment today by calling 954-452-4377.
And we're back to Medically Speaking with Dr. Winston Alexis. This topic, or this episode, our topic is abdominal pain in females. And we've spoken about the acute versus chronic pain. We've spoken about the type of pain, whether it's dull or crampy. We've spoken about what is happening with the pain. Is it starting here and moving elsewhere? And Doc has given us some examples of some roadmaps to show what he believes it may be before he gets into.
As a matter of fact, you know something? This could be for any specialty.
Mm-hmm.
If your eye hurt you, see, boy, is it hurting me in the morning, the evening? Is it running while it's hurting me? Is pus coming out of it? All right, look in the mirror and see if one eye open wider than the other. So when you come in, you could give the eye doctor reason. He doesn't you can't just come and tell me I hurt.
Yes.
Because that's how I always answer back my own too, So what? And of course my patients are accustomed to me. So when I say that, they say, Doc, you know what I mean. I say, yeah. But tell me your symptom. Don't tell me about
Well, again, is this
Dr. Google?
The medical school of Google. Google Medical School.
Dr. Google could go to hell. I hear they trying to take away something from Google. As a big business, they're monopolizing something. I hear it on the news this week. And Facebook too, they're after them.
Good luck.
Right. Well, it's the government regulatory people who say they're going after them. So.
Again, good luck.
Yeah, I know. But
so back to our topic here now.
Now, what I would like to do now is probably concentrate on some female problems in the pelvis. One of the most common ones is uterine fibroids.
Okay.
And the pain tend to be dull, intermittent. A lot of patients describe it more as annoying. You know that kind of pain, it's there, but you could still do what you're doing. And there are times when it gets so bad you have to sit down for a minute or two. Okay. So fibroids tend to be dull and intermittent. That means it's not there all the time. Okay? One of the most important thing about fibroids, it increases with the menstrual period.
Okay.
Right? You have that dull pain, and it gets worse when you're on your period. It's the uterus. All right? So that's one place where you could categorize the pain because you're associating it with something else. Many times the pain is increased with sexual activity.
Got it.
Because sometimes during sex, depending on the position the woman is in, the uterus drops into the vagina. It's more in harm's way. For instance, if a woman is laying on her back, which we call the missionary position, all you young boys know about that, old people know about that. That the uterus is out of harm's way. Okay. It's laying flat, and if you look at the bottom of the vagina, when during sexual activity, it's very hard to access the cervix, which is the mouth of the womb.
Okay.
Now, if the woman lay down and put her legs up like knee chest position, the uterus drops, so that when you're having sex in the back of the vagina, you're now touching the uterus. You understand?
Okay.
So if you kneel down and have sex doggy style from the back, that changes the position too and make pain during sexual intercourse worse. So that's another example. Pain makes it worse. And I ask my patient, does it get worse when you put your legs up in the knee chest position? And lo and behold, they say yes. Or if you kneel down and you have sex doggy style, does it hurt? Yes. That tells me right away this is the womb, and it's probably located in a position in which it's in harm's way. And as a matter of fact, about 1 out of every woman are born that way. Every woman. Not disease, they're born that way. And just by changing the position, you alter how much trauma you get to the uterus during normal sex, especially during the time when climax is coming, when there's deep penetration. So I'm talking about even a thing. Does the pain hurt with sex? You might wonder what the hell doc is talking. There's a reference. If it's hurting with sex, guarantee you it's the uterus. Guarantee.
Okay.
Right? On the other hand, if they say no, I have to say, damn, this pain might be the ovaries or something else in there. So it's showing you in one condition, uterine fibroids, just by talking about sex, just by talking about the amount of bleeding and what relieves it and what I have a general idea we may be dealing with fibroids. So that's one of the major things that I have to go through when a woman comes with true pelvic pain. Okay. Meaning pelvic pain related to the female pelvic organs. Okay. All right? The second thing is chronic pelvic inflammatory disease. This is infective. The point is, it is not infective at the time I'm examining them. Right? Most of the time when you get an acute infection with bacteria that cause tubal damage, and there are many of them. Some are serious, some aren't. Right? It's an acute process. And you treat it with antibiotics. But sometimes when you don't treat it in a timely fashion, the tubes get scarred up. Okay. And even when you have killed the infection, the scarring is responsible for this chronic, annoying pain.
And how is that treated?
again, we're going to talk about therapy, but I want you to understand the differentiation I have to make.
Right.
Because all of them are pain. I have to differentiate. Is this the pain you get with chronic inflammation of the tube? And again, not acute. This is a type of pain that come and go and come and go. Right? Versus fibroids, which is really centered on the menstrual period.
Good.
This other one is all over the place, all over the time. All right? And if you treat most infections in a timely fashion, the scarring doesn't occur. Okay. There's one big culprit in this. Chlamydia does not cause severe symptoms with pain. So a lot of people hang around with it, and eventually your body heals itself, but by that time it's all scarred up. If as soon as you find out it's chlamydia, we treat it, it is not likely to cause damage. Right? That is one of the reasons why I am recommending every sexually active woman from teenage to the childbearing years, and when the person is very sexually active, should get testing for chlamydia every single year when they do the pap smear.
Okay.
I know the guys ain't gonna like this, guys, and chlamydia can do damage quickly and silently. Now, the other big one is gonorrhea. If you have that, you know it. Believe me, you can't walk, you can't talk, you have fever, and everybody end up in the emergency room. You cannot stay home with this. So because of that, that's treated 96% of the time.
Within a time.
Right, but let me give you an example of chlamydia back home in Jamaica or Trinidad. Mommy, I'm feeling a little slight discomfort down there, you know. I'm going to drink some Cersei tea.
Cure on.
What? And a little bit, put a hot water, something on the belly. And 2 days later, it's gone. But you think because it gives few symptoms, it can do a lot of damage because it heals itself by itself in a certain length of time, and by that time it has damaged the tubes. Gonorrhea is not like that. Everybody in the world know you have gonorrhea. Fever, it hurt. But that's why chlamydia is responsible for a tremendous amount of infertility in young females. And when you ask them, you have had infection in your tubes? No. And when we do the test, they have a bunch of scarring. And we say, because they had a little bellyache that mommy gave them, remember? Some Cersei tea or some lime bud tea.
Right.
And drink 2 Panadol and go sleep.
Of course.
Right.
So again, that's one of these things that I now that you've said it, this could go untreated easily.
Most are. That's the sad part. That's why routine testing is important.
If that happens today and the woman isn't being tested, her annual test isn't for another 4 months.
So I'm teaching them now. Don't worry with the Cersei and the hot water pad.
If you feel that discomfort, go and see your OBGYN.
Little bellyache, mom. If it's enough for you to complain, I have a little tube, and you have to know if you're having unprotected sex.
Okay.
And you say, something, let me sneak in here, nobody business. We go see Dr. Alexis.
Okay.
And let me tell you what I do. I examine them. And even if I'm not sure, I treat them. Because this thing is so insidious. A young, sexually active female who's not using condoms or other protection.
Right.
That come to me with little belly pain, and I don't care what it is, you getting some antibiotics.
Yes.
Because the antibiotics are going to do you no harm, but the chlamydia will.
Okay.
Right?
Interesting.
But the guys ain't going to like it, whether you're married or you're married. You need to get tested for chlamydia.
Get tested.
When you go for you. And by the way, that's you and your gynecologist's business.
That's right.
That'd kill me to find out anything from me, but it's the sensible thing to do.
Okay.
Everybody except Mr. Alexis, I'll kill her if she ever come and tell me. No, that's when I was younger, man. I said, what? You going to get what this doctor do? What? Let me go have a talk with him. What you do? No, honestly, I say that as a joke, but guys got upset. middle income families, poor people here do nothing.
Yes,
But them
yes.
guys say, how dare you tell them I say, sir, I'm not telling her anything, but it's a routine test. Yeah, but you're implying. I said, no, I just doing what the book tell me, I suppose the guy come to beat me up, or how you tell me? And when the tables turn, my boys are there, I know these.
You know how that goes.
Hey, doc, you better give me something, so they might. Back where we come from is a man's world. The guy they cuss if you do that,
and that's all gone now.
Yes.
Here in the good old US of A. And in 2020, most places, it's not like that anymore.
But thankfully, in America, it has become a standard past. You know that of girls under 21.
Mm-hmm.
The CDC. I hope Trump will listen to this. He might deport me. The CDC say that if you're under 21, you don't need a pap smear, but you have to do GC and chlamydia testing.
Okay.
That's routine in young girls.
There you have it.
Right. Now, in the childbearing years, the recommendation is that we recommend it, but they don't have to do it. But in the other one, 21 is standard. You don't have to get permission.
Okay.
Any young girl who come for the annual physical here get that, if they're sexually active.
Got it.
Especially without condoms. But the point is that this little thing called chlamydia is responsible for a lot of infertility. And it breaks my heart when I see the young woman, the tubes all mashed up. We have to send them for IVF.
Oh, dear.
Yeah,
So young ladies, please ensure that you're being tested for chlamydia.
Routinely. Once a year.
And if you do experience pain,
don't wait for your annual.
All right.
Just go by a doc quick and say, Doc, I'm having this pain. Again, it comes under chronic pain. If it's a little pain, and by tomorrow morning it's gone.
Right.
But if by the second day you're still having it, you have to say, hey.
Something is
up.
up.
Man, yeah.
Something is
So
up.
I ain't saying run the same day, but keep an eye on it.
All right.
Right? If it completely goes away within a day, it's nothing serious.
All right. Give me one more thing that may cause this abdominal
and that's the big three: fibroids, chronic pelvic inflammatory disease, and endometriosis.
Yes.
All right? A strange condition. Hard to explain. But I'll try my best.
Well, we know you're good at that.
I had to be careful with my wife. She's going to sue me for calling up her name. I think with family example, I tell people my prostate gone. It make people feel, look, Doc is human, I can really. But I can't call the lady.
No.
All right. Endometriosis is one of the leading causes of infertility in young females, right, who have no history of previous disease.
Okay.
All right. The major symptom of it, what makes it so funny, is menstrual cramps.
All right.
So there's regular menstrual cramps, and there's menstrual cramps related to endometriosis. And it's my job to figure out which is which. So I've given you some guidelines now. It's called dysmenorrhea. Cramps at the time of your menstrual period.
Okay.
If it occurs only during the menstrual period and is not strong enough to prevent you from being able to do your normal physical activity. You could go to school, you could go to work, a little uncomfortable, take a couple of ibuprofen, and you could make it through the way. That's usually normal dysmenorrhea.
Okay.
If it's disrupting your life, especially young girls, you're vomiting, you're having diarrhea, you can't go to school, that is not normal. You need to go to your gynecologist, let them do a few tests that may be able to tell us. Because if you do, and by the way, that's one of the leading signs of endometriosis. So I have to differentiate between regular menstrual cramps and cramps associated with this endometriosis. And that's how we do it. Endometriosis pain tends to be worse. It tends to increase with time, and it prevents the person from carrying on the normal physical activity.
And what causes this?
Oh, God, that's the part I didn't want to get into. Because
we have to,
it sounds like something, but it's true. All right, let me go back to you now. You always ask me these kind of... It's because you're not a woman. I think we need it.
You know...
You just nosy. You want to find out...
I want to know. And our listeners want to know.
All right, listen, what happens is if a woman don't get pregnant at the end of a cycle, the body has to shed the whole lining on the inside of the womb because that was built up for if she get pregnant, a baby could attach to it. If no baby come now, you get rid of that and you start rebuilding it for the next month. So every month, a woman during the menstruating years shed the entire surface of the inside of the womb. That's your menstrual period.
Okay.
All right? Now, what we have found out is that not all of it come out. Some go in the opposite direction. So it's going through the tubes now and dropping out into the belly. So most of the period come out, but a little bit drip backward. It's called retrograde, mean going in the opposite direction, menstruation. Apparently, every woman in the world it happens to.
Okay.
All right. Now, what happens? Remember, those are little pieces of the lining, right? The lining that really come out as your period.
Right.
Those lining are actually the lining that builds up for the pregnancy and then shed. So that lining, in most women, the body immune system destroy them and they disappear. In some women, they stick. The body don't destroy them. Okay. And they attach themselves to anything they drop on. And every month when the woman is having a regular bleeding, they bleeding too. But the blood ain't no way to go. When you bleed from your womb, it coming out through the mouth, through your vagina. Now, if this is attached to a piece of your bowel, there ain't no way for the blood to go. Okay. So the blood dissect in between the tissues. It's like somebody forcing blood through, and that is what caused the pain. Okay. And what happened time, we find that process, we don't know exactly why, these little pieces of thing in there that called endometriotic implants interfere with the fertility process. We don't know exactly how, right? But we suspect abnormalities in the immune system because that's why they could live there anyway. Normally, they're destroyed by your immune system. Right. So we think the infertility is associated with some immune response in the belly from these abnormal, we call them endometriotic implants. All right. And they could go anywhere, on the bowel and the ovary. So those are the big ones. Pelvic inflammatory disease, endometriosis, fibroids. Those are your three biggest cause of female chronic abdominal pain. Acute is usually a ruptured cyst or ovarian or a twisted ovarian cyst. Those are an ectopic pregnancies. Those are that's when you hear abdominal pain, you see how many things I have to rule out? That's why I wanted to talk about it. It's not it's not like something you have a cold, we give you some antibiotics. I have to search and use blood work and imaging and my ability to feel things. Of course. And to talk people and come up with some logical. That's why gynecologists have to be pretty smart people. They're the good ones. Really? Yeah. Like that, they have a joke, and it turned out bad, The general surgeons have a way of saying, a gynecologist, they ain't no surgeon. So my back to them, I said, listen, disease, you only just chop out everything. You don't know what the hell you're doing. My job is to preserve and reserve. Your job is to destroy. Indeed. Right, yeah, but but you could see we're taking care of women. It ain't that easy. Right? And I think my wife, oh God, I promise not. A lady once tell me that the reason why I'm so good at it, I like to talk. Yes. So how you get a good, if you go in there and the man say, what, your belly hurt? All right, turn around, back, have a nice day. But it stands to reason based on, again, doing a few of these shows with you that the interview. Yeah, it's very important. Yes. And that is the one nobody had time for. Yes, yes. And also for the patient to really take note of what is going on with you as the patient. Thank you.
and your family history.
And
making note of it so that you can
exactly.
speak about it when you do meet with your physician.
And don't complain when you come to certain doctors' offices and you have to wait long.
Yes.
Because to get a proper history take time.
That's correct.
And to do a physical exam take time.
Yes. Yes.
Right? I tell my patients that all the time, they come to complain. I say, listen, dear, you know what's really good? I am not the only great gynecologist around. And you notice what I said? I am not the only. I have to big up myself, but
you're great, but there are other great ones.
But I say, yeah, man, so why don't go and find one who could take 2 minutes to take care of you? My problem is, I don't know how much long I have to spend with the patient before you.
Mm-hmm.
So don't take your lunchtime and come here. You take a whole half day to go do your hair.
Yes.
And my wife, well, she said don't call her name. My daughter and somebody else go and paint the nails and toes and things.
How was that?
And you want to come in the doctor's office and leave 15 minutes. Come on, lady.
Correct.
Right? You need time. By the way, that same lady, I thought she'll never come back because she cussed me up. So one day I peep out in the office and I say, boy, who that name is, Doc? But hey, and look at she say, Doc, I bring a book.
And she patiently.
Yeah, she said, I bring a book, it's all right. And she reading.
Right.
I thought she would never come back. It's amazing. Once you explain to people, I say,
right.
It's simple. I don't know how long. Suppose your time reached and I need to spend an hour with you. You want to say, oh no, the next patient, get 10 minutes, give me a break. No, man, take time off when you go and see your doctor. Eh? Not only me, primary care, anybody. Give yourself a holiday. You're sick? I'm taking a half day, I'm going to sit down in my doctor's office.
That's right.
Right, but anyway, I think it's a good, I hope the patients get a little, the takeaway, I think, is look, don't just come and give your doctor one symptom. There are a whole lot of things related to it that he has to use to come up with a diagnosis. I'm going to end by giving you a good example. A lot of the pains that feel in your belly come from your back. How about that, ladies?
Okay.
A significant portion. Guess what? Women get damage to the back all the time. From lifting, from the shoes they wear, posture. Low back pain is a common thing in women as they get older. And by the way, what happens in the spinal column? It's all bones. One on top of the other like bricks. But between the bones, there's a little space through which the nerves in the middle of the spine come out to go where they have to go. So they come out from your lower back and they get pinched at your lower back. But the nerves actually end up in your lower belly, your groin, all the way down to the leg. So even though it's in the back, guess where you get the pain? In your lower belly and your leg. So a lot of the pains in lower abdomen is due to damage of the nerve or compression of the nerves in your lower back. Example, your neck. A lot of the numbness and tingling you feel in your finger, the nerve is being pinched up in your neck. It's called referred pain. And nothing wrong with your finger and them. It's just the nerves tend, when you squeeze it at the point of entry, it interferes with all the areas that the nerve go to. That's why finding out how a pain goes help the doctors to map where this might be coming from.
Right. Well, ladies and gentlemen, that's a wrap for this episode of Medically Speaking with Dr. Winston Alexis. New episodes available every Thursday at 11:30 a.m. Eastern Time on your favorite podcast platforms. Ladies and gentlemen, this show has been produced and presented by the Caribbean American Connection. And thank you very much for your time. We'll talk to you again next week.
We appreciate your time with us on Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join us next Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms. Doc is back. Although the host and guests are qualified professionals, they assume no responsibility for inaccuracies, omissions, inconsistencies, and any slight of people or organizations. Listeners should use their own judgment or consult an expert or their personal physician for specific applications to their individual medical problems.